Perfect.
Okay.
Okay, good. All right. Well, we'll go ahead and get started. Hello, everyone. My name is Jill Johnson, and I'm the Executive Director for the International Society for Quality of Life Studies. We're very, very thrilled today to have Uriel Leviatan. Am I pronouncing that correctly? Leviatan?
Leviatan.
Leviatan, okay.
Leviatan is hopes.
Leviatan. Okay, good. Well, we're very pleased to have him. He's coming to us from Israel in Haifa. And today his presentation will be influence of spouses' work role, similarity on intergender difference in life expectancy. Before we get started, I just want to remind everyone that this is being recorded and we're going to be posting this up on our YouTube page to share with our community afterwards. We ask that during the presentation that you keep yourself on mute. If you have questions, feel free to post those in the chat bar, and we'll address those at the end of the presentation. The chat bar, you can just take your cursor down if you're not familiar with Zoom and just type in chat and type in your question, and we'll have time at the end for questions and comments. Other than that, please do keep yourself on mute and your video off to preserve our bandwidth. And with that, Yuri, we'll go ahead and get started.
Okay, good evening, whoever is watching me and whoever will be watching me in the future. I don't see myself, so if I do mimics that you don't like, just tell me so I'll stop doing them. It's a very strange situation since I'm talking to a screen which has only my PowerPoint presentation on it. But I'll assume that you see me. And since I wasn't sure how it will go, I will be mostly reading my lecture. I wrote it so I don't get confused by not seeing anyone. This year I wasn't teaching, so I didn't have the experience of Zoom teaching. All my colleagues have been teaching in Zoom, but I didn't have that privilege. So let's go to the topic itself. And also, of course, there is the advantage of a Zoom lecture that I can, I don't have to be dressed up. So you'll excuse me that I'm so casual. My topic is influence of spouses' work role similarity on intergender difference in life expectancy. And I start by two facts. One, life expectancy for women is longer in all industrial societies. And the other fact is, as life expectancy of societies increases, so does the intergender difference in life expectancy, meaning women gain more. This can be seen in the next three slides, two that look at the changes in life expectancy and intergender difference in life expectancy across time. Here are 8 countries, 3 years, 1900, 1950, 1998. And as you can see, in all countries, in all times, females fare better in their life expectancy. I'm moving the pointer along the female column, and as you see, it's always true. So on average, in 1900, the difference was about 3.1 years. 1950, it was about 4.2. In 1998, it was about 6.2. And as you see, the average life expectancy rose for males from 46.9 to 74.6, for women from 50 to 80.8. The next slide shows data from 32 countries, industrial countries, during the years 1960 to 2000, and the same pattern. Always males fare not as good as females in life expectancy. And the difference in life expectancy goes up as the years pass by. It comes then to more than 6 years on average. The next slide shows a scatter plot of life expectancy here on the horizontal line, and difference in life expectancy on the column. And it is data for 73 countries, 73 societies. And as you see, there is a very clear relationship. In fact, the zero order correlation is about 0.75. And when you look at life expectancy at age 50, it reduces, of course, the number of societies to 64, and the correlation is, if I'm not mistaken, 0.59. So adds to this trend the fact that men within most families are older, and at least two major problems emerge. Industrial societies get a very large number of old widows without the support in all aspects of male spouses. And the second problem is an extra demand on the welfare resources of society. Therefore, the intergender difference in life expectancy is of major importance for welfare policy making. It is also of major importance from the perspective of the individual widows, being left without spouses at an age when their own personal resources are at a low level. Why the intergender difference in life expectancy? Past research into this topic suggested explanations moving like a pendulum from an emphasis on biological and genetic explanations to those stressing environmental and societal factors. Examples of biological causes: females live longer in most species. Females have a faster males have a faster metabolism. The higher level of cholesterol among males. The female hormone that prevents the building of cholesterol layer on blood vessels. The superiority of the female hormone that prevents building of cholesterol layer on blood vessels. The superiority of the X chromosome over the Y chromosome. As a result, death rates of men from certain diseases are higher than those of women, like leukemia, tuberculosis, cancer, blood and heart diseases, malnutrition, while while rheumatism and diabetes are more important causes for female death. Then we come to explanations that are social and environmental. Males have more stressful life experiences. Gender differences in role expectations are in favor of females. Males are more exposed to physical dangers. Females get more social support from their social environment. These factors have different levels of representations among different societies, and so societies do vary in their intergender differences in life expectancy. An appropriate summary of the evidence is therefore one that acknowledges the role of genetics and biology, but also acknowledges the importance of social and environmental causes. The next question then is, once important social causes of the intergender differences in life expectancy are identified, how may it be reduced? My interest in this question started several decades ago. I was doing research on social causes of well-being and health among kibbutz members in general, and the elderly in particular. As part of that project, I wanted to calculate life expectancy for that population. This necessitated the calculation of age and gender-specific death rates, which surprisingly was not done before for the kibbutz population. Looking at the data needed for the calculation, I was amazed to discover that contrary to my expectations, kibbutz males and females did not differ that much in age-specific death rates beyond the age of 50, when death rates start to be noticeable. On the basis of the regression calculated from the data in slide 4, the expected intergender difference for kibbutz population should have been about 7.25 years. But in reality, it was only 4.6 years. As you can see here, we calculated for 3 years life expectancy at age 0. And as you see, it's 4.6 for the year 1977, 4.6 for the year 1984, and 4.4 for the year 1995. However, a check on life expectancy of males and females as compared in standard scores to life expectancy in other societies showed that both, no, I'm sorry, I missed the paragraph. My first reaction was alarm. I thought to myself, oh my God, here is proof that work kills. This was because I knew that kibbutz population was one of the few populations at that time where 100% of its female members were part of the labor force market, as all men were. However, a check on life expectancy of males and females as compared in standard scores to life expectancy in other societies showed that both genders of the kibbutz population have life expectancies that are among the highest. Yet, while both were high, the level of life expectancy for kibbutz males as expressed in standard scores was higher than the relative level of kibbutz female population. So work doesn't kill those who engage in it, but perhaps it is a factor in another way in closing the gap between genders in life expectancy. I focused on possible explanations that would exploit unique characteristics of kibbutz society. Indeed, research demonstrated some of the major contributors to the very high level of life expectancy in kibbutz population. For instance, a strong emphasis on developing and expressing social capital, offering work role opportunities to the very old, strong social support from community and extended family, socioeconomic equality among members. However, all these should contribute in an equal way to both genders. We should find what differentiates kibbutz from the outside world and is gender relevant. I decided to focus on social support, knowing that one, it is a major contributor to life expectancy. And secondly, spouses are the most important sources of social support. Moreover, thinking about social support between spouses brings to mind that empathy between them enhances the effectiveness of social support. Because when partner has empathy for his or her partner, the social support he or she are willing to offer would be more effective as it would be aimed at the right problems, at the right needs, and at the right time. That was when I came with the idea that in industrial society, the potential level of social support offered from female partners to male partners is in many instances and on average lower than the social support offered in the opposite direction. My reasoning was as follows. In industrial society, the common practice is that most male partners have work roles in the outside labor market, and only a smaller part of the females belong to it, while many of the females work at home as housekeepers. When not both spouses are part of the outside labor market, there exists asymmetries, so I hypothesized, in level of potential empathy as regards the work role of partner. Female spouses who are housekeepers and were not part of the outside labor market have little opportunity to know their partner's problems and experiences in his work role. In contrast, male spouses should know quite a lot about their partner's role as housekeeper. After all, they live in the same neighborhood, know the neighbors, know the house, know their children, so I hope, etc. Back to the kibbutz. On the kibbutz, this asymmetry is strongly reduced and therefore a strong opportunity for empathy by the female spouse in the direction of her male spouse. This is because, as mentioned earlier, kibbutz society is characterized by both all men and women being part of the labor force market in their communities. Therefore, experience of most central aspects of life is shared similar for both genders. Thus, each of the partners should be able to develop in a systematic way empathy for his or her partner as regards his or her most central role in life, work role. In addition, kibbutz communities offer several other conditions for enhanced empathy between spouses, empathy that should lead to enhanced social support between them. Both spouses live in a small and relatively old and close social community where the exposure of each toward the other is strong, and it is easy to follow your partner in all his her activities like work, leisure, public, and family in a small community. Kibbutz is not only a small community, but also an intimate community. This offers encouraging conditions for gossip, for friends and neighbors telling the other partner about problems his or her partner might have. The kibbutz community is also characterized by an open culture where legitimacy is given to discuss any topic, including work, income, personal problems, psychiatric problems, interpersonal problems, etc. However, all these factors should contribute equally to empathy and to social support for both men and women on the kibbutz. We should look for the processes through which these factors of similarity between genders on the kibbutz contribute to the outcome of reduced difference in life expectancy. At this stage, we developed a theory that is composed of two parts. It is social support that contributes to life expectancy via the enhancement of well-being, health, and life satisfaction, and in the final count, closes the intergender gap in life expectancy. But this happens because strong and similar levels of empathy is developed between both members of the family on the kibbutz. Compared to other societies, female spouses on the kibbutz, on average, have stronger empathy for their male spouses due to the combination of factors that result from kibbutz important characteristics, as I enumerated earlier. Thus, our causal flow model has the following links. Similarity of spouses in work roles increases empathy between spouses, makes social support among them more effective, and brings about well-being, health, and then reduces mortality and increases life expectancy. In addition to my initial interest in intergender differences in life expectancy, I was also curious to find an answer to a less academic question. Is it good or bad, health-wise, for spouses to hold similar jobs, similar social roles? The following several studies offer some answers for these questions. To test the theoretical model at the individual couple or couple level of analysis, we conducted two studies. Study A, that ended up as a master thesis by Yitzhak Levin. It included 50 couples aged 25 to 65 from one kibbutz. Similarity in work roles was measured along three categories. The first category, both partners work within kibbutz and in similar branches like agriculture, industry, services, or education. Second level, both work within the kibbutz, but in different branches from among those branches that I enumerated. The third level, one of the couple works within kibbutz and the other outside kibbutz boundaries. Empathy was measured by extent of congruence between desired states across domains by one partner and knowledge of those desired states by the other, summation over 25 different spheres. Social support was measured by a report of each individual about extent of support given by spouse in different domains of life and in several modes, like actual help, psychological encouragement, acceptance, and being a confidant. Health and well-being was measured by self-evaluation of own health, by satisfaction with life and with different domains of life. While all conditions for high level of empathy exist in kibbutz communities, they are small, as I said, intimate, culture of openness, and all in life in the labor force market. And while the 50 couples were from same kibbutz, the extent of intra-family work role similarity still made a positive difference in health and well-being, all due to level of empathy and level of social support. Here are the data from that study. As you can see, work similarity affects level of empathy affects social support affects level of well-being, and we can see that social support in fact intervenes between empathy and well-being, because when we measure the relationship between empathy and well-being, it is reduced measurably compared to the direct relationship as shown here. And here is another slide that compares the three groups of couples. Couples, those who have similar jobs within kibbutz, and these are percent of couples expressing high levels of empathy as a function of job similarity, 45% of these couples. When the jobs are different, but still within the kibbutz, only 29% express this level of empathy. When the jobs are so that one works within the kibbutz and one works outside the kibbutz, it is reduced to 20% of the couples. Thus, affirming importance of similarity of work roles over and above other factors. In order to make sure that this finding is not unique to kibbutz population, we tested the same model with a non-kibbutz sample, but with similar characteristics. In study B, which turned into a master thesis by Avital Gamliel, again, we had 50 couples aged 25 to 50 years old, and at least one of them, of each couple, was a career officer in the Air Force. Work role similarity was measured by job health, similarity measured and based by a certain instrument we found in the literature, and by type of organization in which one worked. All males were part of the labor market, and so were also all females except one. And all of them, or almost all of them, lived in a military camp, in a family housing on a military camp. So in many ways similar to a kibbutz community. The other variables were measured with same instruments as in the first study. Here again, extent of work role similarity still distinguishes itself over and above characteristics of relatively small community within one branch of the military, many of the families living on same military family camp. These two studies I described are at the individual couple levels of analysis and are psychological in their emphasis. Then we conducted two studies of a sociological nature. In study C, one was, it was of a very small scale. We exploited the fact that at the time of the study in kibbutzim, there existed 4 different kibbutz federations with somewhat, I say at the time, because now there are only 2 federations. 4 different kibbutz federations with somewhat different characteristics in their ideology and in their individual internal organizations. 3 of the 4 were about similar in size. The 4th was very small, and we didn't include it in the study. But the 3 were similar in size of population and number of kibbutzim. We tested for differences among the 3 different kibbutz movements as regards intergender differences in life expectancy. I found that they differed from each other and that these differences were related to extent of similarity between their female and male members in terms of holding public office or managerial office in their community. The higher the rate of female members holding office, and therefore a more similar percentage to that of males, the smaller was the intergender difference in life expectancy. In the 4th study, which turned into a master thesis by Isolde Schreiber, analysis of data from 32 industrial societies across the years 1960-2000 in groups of 5 years. 4 measures were in use: life expectancy for each gender, intergender life expectancy difference for each society, percent of female participation in the labor market, and estimates of similarity in occupations between the genders in each of the studied societies. So what we have here the mean female participation in labor force from the year 1960 to the year 2000. And as you can see, it increased as the year went by, but also the standard deviation decreased, which is important for interpreting the data later. Oh. I have pop-ups on my screen, which I don't know how to get rid of. Then you have here mean level of female-male similarity in occupations in each of the countries, but on average across the countries for the groups of years. And as you can see, the similarity also increased as the years passed by. So it was 52%, and that's females similar to males. It rose up to 64%, but the standard deviation also went down. So then I took this four variables and run a correlation analysis for them. And this slide demonstrates a surprise finding. Male-female difference in life expectancy increases as female participation in labor force market increases. See here. Female participation, it's correlated positively with level of life expectancy. Perhaps the positive outcomes of female life expectancy of having a work role outweighs its contributions to enhance life expectancy for males. No direct contribution of male-female similarity in occupations to life expectancy or to male-female differences in life expectancy. But then I analyzed the partial relationship. So first I held constant the female participation in labor force with the female-male difference in life expectancy, while life expectancy is held constant. This is the partial correlation. And as you see, it is very positive. So it is positive for the years, that's for the years 60 to 2000, and this is for 60 to 1980, and also very similar to 1980 to 2000. But then I held constant the female participation in labor force. And here, suddenly, the expected, by theory, correlation emerges. Negative correlation, partial negative correlation between female-male similarity in occupation with female-male difference in life expectancy. Minus 2.82 for the whole range of years, minus 0.474 for 60 to 80, and it disappears for the years 80 and 2000. Then I did a multiple regression analysis where the dependent variable was the female-male difference in life expectancy, and the predictors were life expectancy, females in the participation in the labor force, and male-female similarity in jobs. And as you can see, all three variables contribute to explaining the variance in the female-male difference in life expectancy. So some points of summary and discussion for this last study. Male-female similarity in jobs was measured here very crudely on the basis of national statistics. Contrary to expectations, at the zero level of relationship, it was not related to male-female difference in life expectancy, neither to life expectancy. Female level of participation labor force was positively related to life expectancy and also to male-female difference in life expectancy, indicating the importance of having a work role for well-being. However, when level of female participation in life labor force is held constant, a strong relation is found between male-female similarity of work roles and intergender differences in life expectancy, despite the crudeness of the measure. Now, more general comments. This series of studies showed relative strong support for the general theoretical model I presented. Important is to note the strong effect of similarity in work roles between spouses as a determinant of level of their empathy towards partner. Both studies of the couples were with samples who live in small and closed communities, and yet the effect of work role similarity was so noticeable over and above other factors. The studies supported here show how the structure of central social roles, here the focus was on work roles and extent of their intergender similarity, determine important behaviors and determine relations among spouses. However, in my view, the central finding is the importance of level of empathy between spouses. True, work role similarity goes a long way in creating such empathy, but this is not the only way for creating it. Level of communication, both in quality and in quantity, between partners can also create very high levels of empathy. In study B, the study with the military people, individuals were asked about the length of time they communicate each day with their partner, the extent of satisfaction and pleasure they have with this communication, and whether or not there exist topics that are never discussed. By the way, their communication on average was about an hour and a half a day, ranging from about 40 minutes to 2 hours. The study found a high level of correlation between quality and quantity of the communication with level of empathy and also with level of social support. So you don't have to work in the same job that your partner works in, but it's important that you talk with each other. In fact, I can tell you a story here. Some years ago, I was in India and I gave a lecture on this topic to a group of graduate students of psychology, mostly women, in Allahabad University. And as you may know, in India, the common practice is arranged marriages. So after the lecture, several girls came to me and said they want to talk to me, and one of them says, but my parents already chose a husband for me. And I'm not sure that he'll be working in the same field that I am. I'm going to be a psychologist. I'm quite sure he will not be a psychologist. How can we have empathy with each other? I told them, you know what? Try to find ways to talk with each other. Thank you for your interest. Okay, what happens now?
Great. Thank you so much, Yuri, for that wonderful presentation. Really, really, really interesting information. I'll ask right now, we have several people that have hopped on. If anybody has any questions, feel free. Yuri will stay with us for a little bit. If you wanted to ask a question, you can unmute yourself, or you can simply take your cursor down to that chat bar and ask any questions that you would like. While we're waiting, I just have a question. You know, we were planning to have a trip to a kibbutz in Haifa, where you live. We were planning that for the ISQOLS community back in March. And unfortunately, because of the COVID pandemic, we had to cancel the event. So I hope we can plan something in the future to come again, so we can learn a bit more about the kibbutz communities and all of this fascinating information. One question specifically related to your research, you know, particularly speaking from someone who is here in the United States, we've seen so much research about life expectancy and community, and how, as you pointed out, that community really does increase, or seems to have a correlating factor related to increased life expectancy. Here in the United States, the tendency is typically to have people in elderly communities to live in amongst themselves, or in retirement homes or care communities, but they're really detached from their families, typically. I'm wondering if in the kibbutz community, if there's a familial lifestyle, if it's not only older generations, but their children and their grandchildren are all living together. Is that the case, especially in your community?
Not for all, but there are many families who are in our kibbutz. In fact, already a fourth generation. Well, the founders of my kibbutz, who were all born at the beginning of the 20th century, are all gone now. And the veterans are now my generation, that is second generation. And some of my friends have grandchildren, and very few have already great grandchildren. And some of them live on a kibbutz, not all. For instance, I don't have any grandchildren on the kibbutz. They live elsewhere, but my neighbor has, and so it goes.
Interesting. And what would you say is the average age of people, particularly in your community?
The average age?
Yes.
I don't know. We have very many young people because it is very customary now to want to join. In fact, we have a long waiting list of young people who want to join us. We are not a kibbutz in the traditional way anymore. And part of the reason people want to join us is because houses are cheap. But also because the quality of life, culture, and education, mostly education, is considered to be of a very high quality. So young couples, children, stand in line to join. And if they cannot join, at least to send their children to be educated here.
Well,
But
we do have a question.
On average, I don't know the numbers now, but I would say that at least about half of the people are below the age of 40. I
Okay.
mean, adults, not children.
We do have a question from Pascal, if I'm pronouncing that correctly. If you want to unmute yourself, and or if you can show your video or whatever you prefer, go ahead.
Hello, my name is Pasquale. I'm here in Rome, Italy, and I have a question for Professor Uriel Leviatan. Thank you very much for your very interesting presentation. I've seen that you have not included education as an important determinant in your study. Only work similarity you analyzed, but not, for instance, education similarity or the level of education as a determinant of empathy or determinant of life expectancy or determinant also of support. So why? Do you think that education has no role, or because it's just your focus was just on work as a determinant?
Yeah, I think you're right. It's a very important factor. And in fact, the two studies that were conducted among couples included data on education. And both researchers analyzed education. They found that its a unique contribution over and above the work role was not, it was there, but not very strong. So in this presentation, I didn't include the leisure activity or office holding activity. I focused on the work similarity because we found that this is the most important factor, even though other factors have their own contribution, but not as strong as the work similarity.
Thank you very much.
Thank you, Pascale. Any other questions? I see Dr. Chitra Narek with us. Ayal, if you have any other questions, I think we have one more. Chitra says, can you please share some points on the elderly couples in the community, like the labor force participation, nature of work carried out by men and women, leisure time activities,
Sorry,
etc.?
I'm sorry. There was some echo and I couldn't hear well. Say it again.
Okay, sure. Can you please share some points on the elderly couples in the community, like the labor force participation, nature of work carried out by men and women, leisure time activities, etc.?
You are asking about older people?
Elderly couples.
Elderly couple. Well, there is a difference between the traditional kibbutz, which now is true only about 40 kibbutzim, and the rest of the kibbutzim, which are about 230 kibbutzim. That in the traditional kibbutz, my own kibbutz, for instance, ceased to be a traditional kibbutz about a few years back. I'm not sure exactly, maybe 5 years ago. Now, what is the difference here? In the traditional kibbutz, people were part of the labor force as long as they wished to. So, for instance, my mother, who was 93 when she died, she worked until she was 92. She worked in the library. She would get up in the morning, sit on her trolley, go to the library, do whatever she was doing there. And if she couldn't get up because she didn't feel well, she was very anxious and sometimes go even when she was sick, because how can they manage without me? And that's an example of many others. In fact, the whole the whole founding generation worked to the very end. Of course, not as full workers. The kibbutz allowed to cease working at the age of 70 for anyone who wanted it. So they volunteered their work, but they didn't have to work full days. So they worked half days, not full weeks, but only 3-4 days a week, not all the year, but taking long vacations, but always being part of a team of workers. So if anything happens to them, the team would be looking for them in the morning. Why aren't they coming if they didn't announce it? In the current kibbutzim, this is changing. In many kibbutzim, people are forced to retire at the age of 70, sometimes at the age of 68, 67, like in the country. These are retiring ages in Israel. And so there are many young retirees because life expectancy has increased. Young retirees on the kibbutz, many of them find ways to occupy themselves, either by volunteering or doing leisure activity or studying or things of this sort. Some do not have ways to fulfill themselves at old age. And that, of course, is a major difference from what it was before. And working to the very old age by choice was probably one of the reasons why life expectancy on the kibbutzim was among the highest in the world. It was it was and still is. I just did a study on this recently. It's about 3 to 4 years higher than the life expectancy of Jews in Israel. And 3-4 years means about 12 years of advancement if things go and develop as they were for the population, the Jewish population in Israel, to catch up with life expectancy of the kibbutz.
Great, thank you. Chicha, did he answer your question? Feel free to unmute yourself if you had any follow-up questions. She says, thank you, sir. Any other questions from any of our viewers? Okay, well, I think that is the end of our webinar, Uri, and I want to thank you again so much for taking the time to present this wonderful research.
I hope it rose some interest in you, and maybe you will be looking for other factors that determine empathy and social support in couples.
We certainly will, and hopefully you can come to our conference next year, if it's in person, hopefully, in Vermont, USA, and continue presenting this information. And hopefully we can also plan a trip to the kibbutz in your area.
Well, we'll see what happens with the corona.
We will see, absolutely. Well, thank you again, and thank you to all of our participants. As I mentioned before, we'll be posting this on our YouTube page and sending it out. So thank you again. And with that, we'll say goodbye.
Goodbye.
All right. Thank you again. Take care. Thank you, Uri.
Thank you. Bye.